This is for nasotracheal suctioning. So first you're going to check the patient's chart, make sure you have the order in the chart, and then gather your supplies. That would include a sterile suctioning kit, and you would head to the patient's room. Hello, Mr. Blank. My name is Trisha, and I'm with Respiratory Care. So today we're going to do some suctioning through your nose. Sounds like you're having some secretions. I can kind of feel them on your chest here. So we're going to go ahead and suction and help you get those out for you. So first, I need to verify your name and date of birth. Okay, and then the first thing we're going to do with this procedure is I'm going to give you some oxygen. We like to have you good and oxygenated before we begin. So as I'm putting the oxygen on, then I'm going to complete my assessments. Again, feel that chest, to feel those secretions there. We're going to get the vital signs, listen to breath sounds. I'm going to put on the pulse oximeter, and I'm going to leave this on the patient's fingers. Mr. Blank will keep this on your fingers so that I can watch that. If at any time the oxygen level drops, then we want to stop what we're doing. So we've got that ready. We have our suctioning on the wall. We're going to turn our suctioning on to -100 to -120 for this adult patient. And then we are going to get started. So I'm going to open my sterile kit and put on gloves. We are going to try and keep one sterile hand and one clean hand. Okay, and then I'm going to open my lubrication, and I'm going to put that either on the sterile kit itself, or I would put that on the palm of my hand. We are going to get our catheter out of the kit here, and we're going to attach that to our suctioning. And then we want to ensure that it's working properly. So we have our sterile saline. We're going to put the catheter tip into the sterile saline and include the thumb port to ensure that we see that saline coming back up through the catheter. That lets us know our suctioning is working. So the suctioning is working. We're going to go ahead and lubricate that tip, either from the tray or from the palm of the hand, whichever you choose to do. So we've then lubricated, and then we are going to remove the oxygen. Mr. Blank, we're going to go ahead and remove that oxygen, and we will get started here. I'll instruct you to cough when I get a little ways down, and otherwise you just relax here as much as you can. Nice, easy breathing. All right, so we're going to go ahead and put the catheter tip into the nair. We do not want the thumb port occluded, so we're going to go ahead and slowly enter that through the nair. First resistance, we're going to instruct the patient to cough. That is the vocal cords. Second resistance is the carina. At that point, we're going to pull back slightly, occlude the thumb port, and begin twisting as we're pulling back that catheter. So we're going to twist, pull back. This whole through the suctioning should take less than 10 seconds. The entire process should take less than 15. So we've pulled that catheter out. We've removed those those secretions. We maybe want to feel the patient's chest to see if we've removed those secretions. If there's still, you can feel those secretions in there, then you want to go ahead and do this a second time, but you do not want to go more than twice in one sitting. So we've removed the secretions. We'll get rid of our supplies. Mr. Blank, want to put some more oxygen back on you? Go ahead and re-oxygenate you after that little procedure there. Then we're going to reassess the patient, get the vital signs again, listen to the breath sounds. We've felt the chest to make sure the secretions are removed, and just monitoring that oxygen level throughout. So Mr. Blank, we'll go ahead and take this off. Make sure we have any answers or any questions answered. Make sure Mr. Blank is comfortable, and then we would document everything we've done.